let me first congratulate every Indian for having achieved 1 billion doses of vaccine. And let me thank all the doctors who are here, because you are representative of the community which helped us through the corona period. Each and every doctor is worthy of all respect, and all the respect at my command is offered to all of you. Grateful to all the people associated with the medical profession, be it doctors, nurses, technicians, sweepers, cleaners, everyone. I'm on behalf of the people of India grateful to all of you for having stood the pressure which the time threw on us. And you worked like soldiers. And since you represent that class which saved so many people, I can only say that we all thank Prime Minister Modi for having achieved the unthinkable. We know how naysayers are proceeding, that how will the vaccines come, where will the vaccines come from? We are 1 billion people, what all is going to happen? People were told even not to get vaccinated. We are not guinea pigs, and we are not lab rats, all kinds of things. And respecting all those opinions, are casting all those opinions aside and respecting the words of Prime Minister and scientists who worked at it, and doctors and nurses and all others in the medical field who administered it. I, as a normal citizen of this country, am grateful to each and every one of you for having achieved it. And my own Prime Minister, I cannot say, India is grateful to him, because we elected the right person at the right place. By keeping him at the right place, we've been able to achieve this, which is an unthinkable figure for even the most developed of the world. And it's unthinkable even in the history of the country, because in the history of the country, we would receive vaccines at much, much, much later dates and time when the vaccines were produced, and to our getting access to that vaccine was far too delayed. Except this time, with only a difference of 1 month simultaneously, when a vaccine was produced by any global entity, within a span of 1 month, India produced its own vaccine. Credit goes to the Prime Minister Modi's leadership, because in the month of April itself, he had given those kinds of help and assistance to the companies which are co-producing and producing vaccines, and assigned 3,500 crore to those companies, so that India is able to get its requisition of vaccine completed within the country. Now, that aside, when we talk of COVID, we know it's a communicable disease. And when we talk of breast cancer, we know that it's a non-communicable disease. And today is a day which is considered and recognized as National Breast Cancer Day. I must say that I'm grateful and thankful to Integrated Health and Wellbeing Council for having me over today on their second edition. And we all know that in India, we are experiencing a rapid transition in the healthcare systems, and there is a rising burden of non-communicable diseases, which is also we are seeing, whether it's diabetes, especially post-COVID, or it's breast cancer, which will have its impact on everything else, and other debilitating and chronic diseases from cardiovascular to diabetes and several others are the cause of about 60% of deaths. So it's a non-communicable burden of disease which far exceeds the number of, I don't know the figures right now. Maybe the COVID will change these figures, but these are the figures which are from the past analysis in detail, that non-communicable diseases which are preventable in nature led to greater number of deaths and mortality increase out of these from respiratory and other diseases. So amongst all non-communicable diseases, as per the ICMR, recognize that the most deadly one is the breast cancer. And it's also very common. close to 27% of all cancers in women in the country are breast cancers. And out of all types of cancers, breast cancer has become a major health concern across the Indian cities, especially in the metropolitan cities like Delhi, Bangalore, and Chennai, as it accounts for more than a fourth of all female cancers. The percentage is higher in urban centers as compared to rural areas. Now, I think this could be due to sedentary lifestyle and longer working hours and many other lifestyle factors. And one more could be, which of course a whole lot of you are doctors, but I'm just giving a little my input, that not feeding the babies on their birth is also one factor, because it's been found that feeding children helps as a prevention towards incidence of breast cancer. And in the rural area, there are more chances of women feeding under family pressure or otherwise, or the general social setups or the demand on women is different in rural sector as compared to the urban centers. So when we are talking about a disease like breast cancer, this aspect also needs to be looked at and further strengthened by way of a greater emphasis on feeding babies. It leads to better health of the mothers. The second aspect, of course, is on the prevention part of it, that I'm not going into the details of consumption patterns, use of smoke or non-use also, but you are a secondary smoker by way of being exposed to certain types of gases in the air, and that can also cause this kind of ailment. Late pregnancy also could be one of the lifestyle issues. Stress in urban sector on the women and demand from women are far greater. Obesity, which is also directly related to the aspect of sedentary lifestyle. And these are all synonymous lifestyles of women in urban centers, and synonymous with the causes as identified by the doctors on the breast cancer awareness also. The worst aspect of breast cancer is that younger women in the age group of 40 to 42 are the ones who get impacted by this the most, as compared to the Western data, where the senior women in the age group of 55 to 60 are getting impacted. So when younger women get impacted, you can understand the impact it will have on the social aspects, young children, young family, who will manage care, because if you're 54, 60, whole lot of these things are taken care of by that age, as compared to India, where very young women start to get these kind of cancers. Thus, awareness about the symptoms of breast cancer become very, very important. And since you're heading this campaign, I would say this plays a very, very important role. Because only after there is awareness, there are chances of it being detected earlier, and that detection can happen with regular breast examination, which could be initially physical in nature, and later it can be probed into by different methodologies which are available, and different kind of smears, etc., FNAC, which all of you do, can be a secondary aspect. The importance of early diagnosis and prompt treatment is the most essential aspect of dealing with an ailment like breast cancer. And thus, to win a comprehensive battle of this nature, we need three pillars. One is health promotion amongst women. When there is promotion of health and greater emphasis on women health, then women will go to the second step, which is diagnosis. Only when I'm concerned about myself will I go to a doctor or get myself diagnosed with whatever may be happening inside my system. And then is the comprehensive treatment, that only after it's been diagnosed can a treatment begin. Once these things are achieved, we need supportive care. So greater awareness amongst men also about the breast cancer leads to the impact of supportive care, because when there are women in the family, as a wife, as a sister, mother, daughter, anybody is impacted by breast cancer, the awareness amongst men also becomes very important, because they play a very important role in the healthcare and supportive care mechanisms. So thus I would say that community-based organizations need to be strengthened, and awareness campaigns need to be brought out. Media campaigns, of course, are there, but since we are public representatives and constantly remain in touch with the people on ground, I would request this forum, IHW, through its doctors, if you people wish to run any campaigns or any diagnostic tools or physical examination campaigns amongst women, I could help it in organizing those things in my area, and we can work together, because only when young women are told that breastfeeding is important for this reason, for that reason, and further examination is important so that you can be treated in time, then only we can work together for the risk reduction strategies. So public participation, experts participation, leadership, all need to come on board for the greater well-being of the women. And then when the women are happy, as we say, yatra pujyaste yat naryaste pujyate, तो नारी की पूजा की बजाय उनका ब्रेस्ट चेकअप और हेल्थ केयर चेकअप और वो मैकेनिज्म करेंगे, तो उसका लाभ कहीं ज्यादा होगा, और उसका लाभ प्राप्त करने के लिए जितने स्टेक होल्डर्स हैं उन सबको इकट्ठा होकर काम करना पड़ेगा। और IHW का मैं धन्यवाद देना चाहती हूँ कि उन्होंने इस कार्यक्रम में मुझे निमंत्रण दिया, और तमाम डॉक्टर्स को एक बार फिर मेरी तरफ से आभार और धन्यवाद कि आप सब लोगों ने कोरोना काल में जिस भारत के वीर सैनिक के रूप में समाज की सेवा की, आप सबका बहुत बहुत धन्यवाद, आभार। और जो 1 बिलियन 1 अरब जो आज का आंकड़ा है, उसको अचीव करने के लिए आप सबका सहयोग जो रहा, उसके लिए भी आप सबका बहुत 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 धन्यवाद, आभार। प्रधानमंत्री जी का भी धन्यवाद, आभार कि उन्होंने एक बहुत दृढ़ निश्चय के साथ, सोच के साथ देश को आगे बढ़ाया। नहीं तो लोगों ने तो हमें बास्केट केस बनाकर गिव अप ही कर दिया था कि हम तो बर्बाद ही हो गए हैं। और आप सोचिए कि 1 बिलियन डोजेस अगर हमें 3,800 की कीमत के हिसाब से खरीदने पड़ते, तो हमारा बजट कितना जाता बाहर देश के, उसका भी अंदाजा लगाइए। और वो बात अलग है कि ट्राइड एंड टेस्टेड टेक्नोलॉजीज के साथ हमने इस वैक्सीन को बनाया है, जो कि अपने आप में बेहतरीन वैक्सीन है, किसी भी वैक्सीन से कंपेयर करें तो। आप सब लोग हमारे आभार के और ग्रेटफुलनेस के जो है पात्र हैं। सो थैंक यू ऑल फॉर हैविंग मी ओवर, एंड इट्स जस्ट द राइट डे टू से द राइट थिंग। सही समय है और सही समय पर सही काम हो रहा है, उस सब के लिए सबका बहुत बहुत धन्यवाद, आभार। और ऐसे ही देश प्रगति करता रहे, हम सब लोग एक दूसरे का सहयोग करते रहे। जय हिंद, जय भारत। थैंक यू।